BW Conversations. Today we're going to speak about plastic surgery. When I say plastic surgery, I'm sure what comes to your mind is a lip job or a cheek lift or some such cosmetic or aesthetic procedure. Plastic surgery is a lot more than that. Today we have with us Dr. Richie Gupta, who's the Director and Head of Department of the Plastic, Reconstructive and Aesthetic Surgery at Fortis Hospital. Welcome, Dr. Gupta. My first question to you, Dr. Gupta, is that what are the most common cosmetic surgery procedures here in India? The global cosmetic surgery market is pegged to be $66 billion by 2026. And of course, we've seen a rise here in India also. In terms of cosmetic surgery and aesthetic surgery procedures. So tell us a little bit about this.
Okay, basically there are two types of cosmetic procedures that are prevalent all over the world and also in India. One is the non-invasive ones, in which there is no surgery involved, like simply injection of Botox, fillers, PRP, etc., and maybe tattooing. And the second is the invasive procedures, in which some surgery is involved. So non-invasive procedures, just being by their nature, because no downtime is required, no recovery is required, are much more popular. I would say that these are about 10 times more popular than invasive procedures. Procedures like Botox, which are used for animation lines like these lines. So it paralyzes the muscle and gets rid of these dynamic lines immediately. And fillers, which can be used to fill in concavities like this one here. So it can be filled instantly in a minute.
So in India, basically the cosmetic surgery market is quite unregulated in the sense that not everybody, like you said, that the non-invasive procedures are more popular. So when a person wants to get, say, Botox done or collagen or something like that, they would not necessarily go to a surgeon or a doctor. They could even go into a standalone beauty clinic. So, what checks can there be to prevent that? Because I think there's a lot of mishaps that happen as well when you, go to a standalone beauty clinic or a practitioner who's not a doctor. Can you tell us about this, please?
Yeah, I'm afraid this practice is quite prevalent because non-invasive procedures by their very nature are simple to perform. And so everyone seems to jump onto the bandwagon. And a lot of mishaps can happen. Like I had a patient who was operated by a general surgeon. Patient had a BMI of 40 and underwent extensive liposuction. And all those tracts got infected and she landed up in ICU and on ventilator for around 45 days. So it's very important to go to a registered practitioner, find out the credentials of your doctor before undergoing any such procedure. Regulators can pitch in by actively intervening and stopping this quackery which is going on. Just because the procedure is simple, such as a hair transplant, does not mean it is without complications. You must have heard a couple of years ago, a person died. A person who had extensive hair transplant lasting almost 16 hours. He died because of septicemia. So, these misadventures have to be prevented. And this can be only done if there are stiff penalties and regulators step in.
In fact, there have to be checks put in, and I think people need to be educated on this as well. And they should not just go into a salon or a beauty clinic to get these procedures.
They should not go to the cheapest possible denominator. That is my request to the patients. That don't go by the price. Not everything that is cheap, may be good, and sometimes you may land up in problems. Look at the credentials of the surgeon or the practitioner who is doing that work and be satisfied. If necessary, take a second opinion.
Yes.
And don't jump into the cosmetic surgery.
So in India, what percentage right now is cosmetic surgery, reconstructive surgery, and gender affirmation surgery? If you were to sort of tell us about that a little bit.
See, it's not uniform pan India and or for example pan centers. Like for example, at my place, I'm working in a tertiary care hospital, and since we are doing a large number of gender affirmation procedures, almost 40 to 50% of our work consists of gender affirmation surgery or sex change operations. Particularly in larger centers and in hospital practice, there is more of reconstructive surgery because a lot of facilities are required for reconstructive surgery, like a blood bank, availability of different specialists, etc. Like, for example, oncoplastic surgery, post-bariatric plastic surgery, and trauma surgery. All these are performed in the larger centers. In standalone centers, mainly it's a cosmetic work that is predominantly present. So it varies from place to place and center to center.
So in regards to gender affirmation, you said that where you work currently, there's a lot of gender affirmation surgeries taking place. What is driving the growth? Have you seen an increase over the last few years?
Yeah, see, I've been practicing plastic surgery now since past 27 years, and there's a 30 times increase in the number of patients. Like in 1993, when I started, there were only 4 to 5 patients, and now we are consistently receiving around 150 to 160 patients a year. In 2019 alone, we performed around 250 gender affirmation operations, which may be, I think, the largest number in India. So the growth is fueled by certain things, like the Indian society has become more permissive now, more tolerant to gender variant people, and there's a better understanding. There a number of centers have opened up which perform gender affirmation surgeries, and people have become aware of these, so they are coming out. Number two, the parents have become aware. Earlier, what used to happen that these people used to run away and they used to be with their friends or mates, and they would turn up at the age of 30, 35. Today, parents are bringing their children at a younger age. I'm getting patients in the age of 16 to 18 years, and surgery is permitted after the age of 18 years. So we are performing surgery as soon as patient turns 18 years, so which is a big leap from what was happening earlier. Another thing that has changed is a number of laws and a number of legislations have come up, which have helped. Like the 2012 Bidhan Barua judgment of Mumbai High Court, which said that there is no law which prohibits sex change surgery in India. And it also said that anybody over the age of 18 years, that is legal majority, can give permission for sex change surgery. No parental consent is required. So that was a big help. Then in 2014, NALSA judgment came, which said that follow the psyche of the patient, and laid down a number of provisions which were very, very helpful. In 2019, there was Arun Kumar and Srija judgment, which was again helpful. It said that a transgender woman can become a Hindu bride. It modified the Hindu Marriage Act. So a number of these judgments, number of legislations, a more permissive environment, increase in the good facilities which perform these operations. These all have fueled the jump in the number of procedures.
Right. So basically, it's family support, legislation,
Yes.
all of that has given a good increase, and there's support now, and that is why we're seeing an increase. So,
Yes.
do you find in your practice that there is medical tourism, in this regard, or do you find that there are people coming in from outside for certain procedures? And if so, what are these procedures that they like to come in for?
Yes, medical tourism had gone down a bit during the COVID peak of the COVID era, but now it has picked up again. Now, since many months, I am again receiving the patients. We receive patients from Southeast Asia, the CIS countries, African countries, the Middle East. So we are getting patients from all over, and a lot of these patients are also for gender affirmation. We get a lot of war injuries, a lot of oncoplastic reconstruction where cancer had been removed and patient is left with defects. So, and from African countries, a lot of scar, kilos, burn injuries. So we are getting a lot of patients for foreign tourism, for the medical tourism.
Dr. Gupta, this was very, very informative, and I thank you very much for taking out the time to speak with us on BW Conversations.
Thank you very much. Yeah.